Hello, my name is Michelle Convisor and I'll be doing a health assessment today. Today is January 9th, 2026, and here's a room scan. It's my patient. And then the ceiling and the floor. Okay, I'll be putting down this here. I have my notepad here to take notes. Okay. Hello.
Hello.
Do you consent being recorded? I will be posting this on YouTube as Unlisted for my professor to grade.
Yes, you have my consent.
Thank you. And then what are we here for today?
You'll be asking me detailed questions about my health, and we'll be doing a well exam.
Thank you. I'm going to start with identification. So if you don't mind sharing your name for me, please.
Danielle Koretsky.
And your age.
32 years old.
Date of birth.
June 15th, 1993.
Your race.
Caucasian.
Your sex by birth.
Female.
Okay. And did you come here alone or with someone else?
I drove myself.
Okay. Perfect. What are you here for today?
I've been feeling a lot more fatigued than usual, and I also have had some weight gain.
Okay. When did you notice this starting?
About maybe 3 months ago.
Okay. And then with the fatigue, do you feel any tension or any pain or anything in a specific location?
Headaches, a lot more headaches than before, like 2 to 3 times a week, I'd say.
And can you describe those headaches for me or the pain that you're feeling, some characteristics on them?
Like tension headaches going down into my neck and my shoulders, and nothing really helps. Like once they begin, they don't go away.
Okay. They last all day, or can you elaborate on that a little bit?
Like if they start in the late afternoon, it'll go into the evening, and that's a whole nother story of difficulty sleeping.
Are there any aggravating factors, meaning things that make it worse or that you notice worsen the symptoms when you start having it?
Nothing specific, but I would say that I have been more stressed in the past few months with work, and working a lot more. So maybe it's that.
Okay. And is there anything that helps relieve this pain?
No, nothing. I've tried taking some, warm baths or a warm compress. Doesn't really help. I don't really like taking Advil a lot, so I try to do home remedies, but nothing really works.
I'm so sorry you're experiencing this. Okay, on a scale from 0 to 10, 0 being the worst pain, no pain, and 10 being the worst pain, how would you rate the pain?
Like a 6.
Okay. And then I'm just going to ask you a few follow-up questions. Do you have fevers or any night sweats?
No.
Chest pain, difficulty breathing?
No.
Do you wake up from excessive thirst or excessive urination?
No, nothing really wakes me up.
Okay. And you haven't, have you been traveling lately or been around anyone who's sick?
No, not lately.
Any new medications?
No, nothing new.
Okay. And then by any chance, do you remember the last time you had a physical exam?
No, I don't.
It's important to keep up with those.
I will.
Okay. Can you tell me a little bit about your past medical history?
Nothing like severe, I'd say, but I do get like seasonal allergies sometimes. I get acid reflux sometimes, so I'll take like Tums, but like very rarely, and that's all I can think of.
Okay. And then, one moment here, I'm just writing down the notes. Any past hospitalizations?
I had no hospitalizations, but I did have my appendix removed like 10 years ago.
Okay.
And also, I want to add that besides the fatigue, I've also had more anxiety than usual as well.
Okay. And is that just recent, or is that something you've had for a while?
I've had it, I've dealt with it, but it's kind of coming back up.
Okay. Would you say that it's stress from work and all of that that's starting it?
Possibly, maybe.
Could also be why you're not sleeping much.
Yeah.
Okay. I'm just going to quickly go over gynecological history. Do you have any kids?
No,
Okay.
not yet.
Do you remember your last menstrual cycle?
December 20th of 25.
Okay. And then would you say you get it regularly every month?
Yeah, it's regular.
Okay. And about how many days does your period last for?
Regular amount, like the 28 to 30 days.
Okay. And about 4 to 5 days, it lasts.
Yeah, 4 to 5 days is right.
Okay. Would you say you have a moderate flow, heavy flow, very light?
Moderate.
Okay. Any cramping during?
Yeah, not horribly, but yes, cramping.
Okay. And then, are you in a relationship?
Yes.
So, what, is it okay to ask if you're sexually active?
Sure, I don't mind answering that.
Do you remember your last pap smear?
Last year, in 2025, about a year ago.
Okay. And no history of sexually transmitted infections?
No.
Do you plan on getting pregnant anytime soon?
Not like within the next year.
Okay. Now, quick go over your immunizations and vaccinations. Do you remember if your immunizations are up to date and childhood vaccines, stuff like that?
Yeah, all my childhood vaccines are up to date. I remember about 10 years ago I had to get a tetanus shot. I got all my COVID vaccines, and I remember that I had all my HPV vaccines as a teenager.
Okay. You said tetanus shot you received when?
About 10 years ago.
Okay. Have you had HPV vaccines?
Yes.
Okay. And then as far as medications, do you have did you bring a list, or do you remember the medications that you
I have a
take?
list. I have it here that I'll show you. But I do take something for my seasonal allergies, and I have the milligrams written down there. I take something for the heartburn, omeprazole, 20 milligrams, and I'll take a multivitamin every day by mouth. And I think that's it. Once in a blue moon, I'll take melatonin.
Okay.
Recently, since I've had trouble sleeping.
As far as the omeprazole, do you remember how many times you take it per week approximately?
For the heartburn?
Yeah.
Whenever I get it, which is not weekly.
Okay.
Just whenever.
So like 2 to 3 times a week?
As needed.
Okay.
Yeah.
And then, do you have any allergies to medications?
Penicillin.
I know you mentioned seasonal allergies already.
Yeah.
And then what is the reaction you have when you take penicillin?
When I was a kid, I had a rash.
Okay. Now I'm going to be going a little bit over your family history. I'm going to be asking you about the first and second generation just so I can get a better idea, okay? Do you mind telling me about your mom, if she's alive or deceased, her age, and some history?
Yes, my mom is 58, alive, and past medical history, type 2 diabetes, and I think she also has hypertension.
Okay.
High blood pressure. Yeah.
And your father?
Alive. He is 62, and he smoked most of his life, but he quit about 10 years ago.
That's amazing.
Yeah. And medically, I'm trying to think, I think he has high cholesterol.
Okay.
Yeah. I think that's it.
Cholesterol. Okay. And then your mother's mom. Is she?
She deceased at 78. And she passed from a heart attack, and also had type 2 diabetes.
Okay. Wow, a lot of type 2 diabetes in the family.
Yeah, my mom's side.
And your mom's father?
My mom's father deceased at, I'm trying to remember, maybe, I think he was around 82. And he had a stroke. Yeah, he passed from a stroke. I think he was 82.
Okay. And then your father's mother?
My father's mother is alive. She has had breast cancer. That's it.
Breast cancer, okay. And then your the grandfather, your father's
father, deceased, 76 or something, and he passed away from cancer. I'm trying to remember which one it was. Colon cancer.
Okay. Now a little bit more just about you. Do you smoke or vape?
No.
Never or?
Never.
Very good. Alcohol use?
Socially, like maybe 2 to 3 drinks a week. Like usually wine.
Wine. Caffeine. Do you drink caffeinated drinks?
I have like 2 glasses of coffee a day, and sometimes with my job, I know it's not good, but I will have an energy drink here and there.
And any illicit drug use?
No.
Okay. Okay, a little bit into your social history. You told me you're in a relationship. How long have you been in this relationship?
2.5 years.
Okay. Do you feel safe and comfortable in this relationship and feel supported? Very good. And then, is this the only partner you've had for the last 2.5 years?
Yeah.
Do you guys use protection?
Yeah. Sometimes.
Gotta be careful. What is your occupation?
I'm an OR manager.
Okay. And then how many hours per week would you say you work?
Recently it's at least 40, and I work up to 55 hours a week.
Wow. Okay. Can you elaborate a little more why work has been stressful for you?
I just feel like I have been working more hours lately. As an OR manager, I just feel like I have a lot on my plate, a lot of responsibility, and I guess another thing I've noticed is my job consists of a lot of paperwork and like sitting down, and I feel like I haven't been very good with like exercising and moving as much as I used to.
Okay. And then your housing, do you live in an apartment with your boyfriend?
Mm-hmm.
Okay. And would you say your home environment is stable and safe,
Yep.
comfortable?
Very.
Okay. You have electricity and everything.
Yeah.
Okay, very good. You just went over diet a little, exercise a little bit, but I wanted to elaborate.
Mm-hmm.
Can you give me a little bit of insight on your diet and exercise per week?
Ever since all these symptoms have begun, I have not been cooking as much at home. So
Mm-hmm.
like more takeout, which I know isn't good. I try to eat I'll try to eat my vegetables and fruits, and obviously be still conscious of what I'm eating. And then in terms of exercise, I try to walk maybe like 20 to 30 minutes a day, and that's pretty much it. I used to do weightlifting, but it's been a while.
Mm-hmm. And then per night, how many hours do you sleep, would you say?
Like 5, max 6 hours.
And you mentioned you have trouble sleeping, and
I have
sometimes
trouble
you
falling asleep.
Well, okay.
Yeah.
Does the melatonin help you?
Kind of. It doesn't, not a little bit. I don't try to take too much.
And regarding stress from work, from 0 to 10, how would you rate the stress?
Like a 7.
Okay. I'm just trying to gauge, like, maybe these are things that kind of get in the way of, like, being able to fall asleep. Some of us, I have that sometimes where I'm so overwhelmed with everything that it makes it difficult to fall asleep. So I'm just gathering the information,
Mm-hmm.
okay? And then regarding spiritual affiliation, do you believe in anything?
No, I'd say atheist.
Atheist. Yes. Okay. And then safety when you're driving in cars, do you wear seatbelts all the time?
Yeah.
When you're out in the sun or on the beach, do you wear sunscreen?
I try, here and there.
And then no violence at home
No.
or anything like that?
No.
No recent falls?
No.
Nothing to be concerned about?
No.
And you would say you're independent, you can perform all your daily living activities independently?
Mm-hmm.
Okay. I'm going to do a little quick review of the systems, and you just can tell me if you have any symptoms or changes in every category, okay? Okay, so in general, I know that you've reported fatigue and weight gain, difficulty sleeping. And have you had any fevers or chills, nothing like that at night?
No.
Any night sweats?
No.
Okay. What about your eyes? Do they feel dry or any pain, discomfort, irritation?
No.
Do you wear contacts
No.
or glasses? Okay. Now I'm going to do ears, nose, throat, mouth. But regarding ears, any drainage, any fluids, any irregular symptoms there?
No.
Your nose is, you can breathe well, everything is fine.
Mm-hmm.
Any sore throat, itchiness, dryness in your throat?
Nope.
What about when you get your allergies? Do you feel irritation in your throat?
No. Mostly, if I have my allergies, it'll be congestion.
Okay. Would you say the congestion, nasal congestion, does that sometimes lead to itchy eyes?
Only when I have the seasonal allergies. Yeah, my eyes could be itchy sometimes.
Okay. No ear pain or dental pain?
No.
Okay. You have all your teeth?
Yes.
Okay. Regarding your heart, any chest pain, abnormal rhythms that you feel, like palpitations or like your heart is jumping out of your body?
No.
Okay.
None of
Any
that.
edema or swelling on your legs, hands, or body?
No.
Okay. No fainting?
No.
Okay. Do you have any difficulty breathing or coughing, sneezing, shortness of breath?
Only when I have the allergies do I have sneezing, but no shortness of breath or anything.
Okay. Regarding your gastrointestinal, you said you felt heartburn, and then you take some medication for that as needed. Do you have ever experienced any abdominal pain, nausea, or vomiting?
No.
Diarrhea, constipation? Okay. Do you ever notice any blood in your stool or
No.
urine?
No.
Okay. And then, do you have difficulty urinating? No vaginal discharge or pelvic pain, anything irregular?
No.
Okay. I'm going to be asking a little bit about the musculoskeletal system. I know you mentioned you get tension headaches. Do you ever experience pain in the muscles or joints?
No, just like I said, the neck and shoulder, like, I guess you could call it pain. Like, I just, all
Tension.
of it, yeah, makes it uncomfortable.
Okay. And no, it's not persistent, it's just here and there?
The headaches are persistent 2 to 3 times a week, but the pain in my neck and my shoulders are not every time.
Okay. And then regarding skin, any irregular rashes or moles that are concerning to you, any bruising, swelling?
No, none of that.
No lumps or discharge around your breast?
No.
Do you do your breast exam?
I do.
Very good.
Yeah.
Okay. And regarding neuro, I know we talked about already the tension headaches, but do you feel any dizziness or like the room is spinning, weakness, numbing or tingling in the fingers?
No, none of that.
Okay. And then I know you said you get a little bit anxious, and lately it's been kind of coming up. How would you describe your mood lately?
Probably just like a little bit lower than usual from stress and anxiety.
Would you say you get panic attacks?
No.
Do you ever have suicidal thoughts
No.
or hallucinations?
No.
Okay. Do you have any heat or cold intolerance?
No.
Okay. Any hair loss?
No.
Any extra hair growth?
No.
Any swollen glands? Okay. And then as far as allergies, just the seasonal allergies and penicillin.
Yes.
No reports of okay. No infections or anything like that?
No.
Okay. All right. Now that has concluded the full health assessment, I will be going over the week 1 risk assessment. I believe that this patient, based on her family history, is at risk for type 2 diabetes. Another risk is hypertension or cardiovascular disease. That relates back to her grandparents, and then her mom who had the type 2 diabetes, and her grandma who had type 2 diabetes. And then based on her previous history of anxiety and her low mood today, and in general the stress and fatigue that she's feeling, I would say there's a risk for depression. It relates to, low sleep, lack of sleep, high stress, the intermittent low moods, her weight gain, and I will come up with a great plan for my patient. Thank you so much.
Thank you.